Good morning, everyone. So, today we'll be continuing with our lecture on halitosis, part 3. So, in the last class, we studied about organoleptic test, organoleptic scores, description of its scores, and Rick listing test. Everything we have studied for the diagnosis of the halitosis and the self assessment test. So, today we will be continuing with volatile sulfur monitor test. So the electronic device analyzes concentration of hydrogen sulfide and methyl carpentane but without discriminating between them. This is the role of the volatile sulfide monitor test. Coming to the gas chromatography is performed with apparatus with a flame, photometric detector, and is specific for detecting sulfur in mouth, etc. It measures directly the volatile sulfur compound, methyl metacarpentane, hydrogen sulfide, and dimethyl sulfide. Gas chromatography is considered as the gold standard for measuring the oral malodor. This device can analyze air, saliva, crevicular fluid for a volatile compound. So this is the diagram showing gas collection from the gas chromatography test. So this is the device installed, and in this the nitrogen gas is given, and this is the pure gas tube, and this is the steering plate consisting of the flask, and the flask consists of the reaction vessel, and in the alternative tubes we can see that the gas is trapped and is converted into the liquid through the tubing as it cools down. So ninhydrin method of detecting amine compound, this is the another method in which it was given by Ivanica et al. In 2005, which shows that the amine level were higher in the saliva of subjects which were suffering from halitosis and lower in the healthy control group. So ninhydrin test detects the amine composition present in the halitosis patient is higher than the healthy control group. So this is the ninhydrin detection test, and this is the result in which it gives out a purple color in the positive test, and thus it detects that the alpha amino acids are present in the halitosis group. Now halitosis system. Now how do we control the halitosis system, as it is given that a proper oral hygiene, a proper brushing technique, mouthwashes is used. So these are the few preventive measures, and we can detect it through the volatile sulfur compound and polyamines, as amines are more relatable in the halitosis group of the patient. Now topaz test, this is the other test which is used. It detects both the volatile sulfur compound and the polyamines in the sample. The absorbent point given with the kit is inserted into the pockets of the patient, and it is left in the place for about 1 minute. It is submerged absorbent point tip in the toxin reagent. Then we have to wait for around 5 minutes and see the yellow color in the specimen on the scale of 0 to 5 points, which is directly proportional to the level of toxins in the sample. Now coming to the BANA test, this is the most simple test and the most preferable test used to determine the proteolactic activity of certain oral anaerobes that contribute to the oral malodor. Here we can test the oral anaerobes, oral bacteria, which contributes to the oral malodor. So the photo shows the BANA test kit given and how does we measure the oral anaerobes. So coming to the cumulative advantages and disadvantages of all the halitosis system, it includes the organoleptic test. Its advantages: good in subjective assessment. Problems are not precise in quantity, depends on the examiner's olfaction accuracy. Coming to the volatile sulfur halitometry, advantage is good in quantifying the values, but it does not record all the odor present in the breathed air. BANA test, it is the complementary test related to the halitometry. It needs a complementary assessment test. So how to check oral malodor? This is the quick test which we can go through it. First one is halitometer, or tool to check the oral malodor. And halitometer is generally represented by readings. So while putting in the mouth, we get some readings. So this readings determines the presence of oral malodor. So Glickman's classification for halitosis with treatment are genuine halitosis, which is also known as the physiologic halitosis. Malodor arises with intensity beyond socially acceptable. And physiologic halitosis with treatment 1, malodor arises through proliferative odor. Temporary halitosis due to dietary factors, example garlic, should be excluded. Pathologic halitosis, oral halitosis with treatment number 1 and 2, halitosis caused by disease, pathologic condition or malfunction of oral disease. Halitosis derived from disease, that is from tongue coating, xerostomia. Okay. And extraoral halitosis with treatment number 2 and 3 with malodor originating from the nasal, paranasal, anterior laryngeal regions, from pulmonary tract and upper digestive tract infection, from disorder anywhere from the body like blood-borne diseases which are emitted via the lungs due to diabetes mellitus and hepatic cirrhosis. Now coming to the pseudohalitosis, which is the obvious malodor is not pursued by the others, but the patient stubbornly complains of its existence. Condition is improved by counseling of the patient, education and explaining the examination results. Coming to the halitophobia with treatment number 1 and 5 with genuine halitosis or pseudohalitosis, the patient feels like he or she is having halitosis. There is no physical or social evidence existing for the same. So coming to the preventive measures, that how we can overall prevent the halitosis. Number 1 is visit to the dentist regularly. Periodical tooth cleaning by the dental profession is needed. Brushing of the teeth daily with appropriate brushing technique and for a duration technique for about 2 to 3 minutes. Use of tongue scraper to get rid of the lurking odor caused by the bacteria on the tongue surface. Flossing after brushing to remove food particles stuck in between the tooth surfaces. Limit the taking of strong odor spices. Limit sugar and caffeine intake. Drink plenty of liquids. Chew sugar-free gums for few minutes when your mouth is feeling dry. Eat fresh fibrous vegetables such as the carrots. Coming to the management, treatment needs for halitosis have been categorized in order to provide guidelines for the clinician for treating halitosis. So, if there is some pathologic halitosis or halitophobia, it should be undertaken by a physician or a medical specialist such as a psychiatrist or the psychologist for treating the halitophobia. Mechanical reduction of intraoral nutrients and microorganisms, chemical reduction of oral microbiome load, rendering the malodor gases non-volatile, masking the malodor. So mechanical reductions can be tongue cleaning, toothbrushing, interdental cleaning, professional periodontal therapy and chewing gums. Chemical reduction will be chlorhexidine mouthwashes, essential oils, two-phase oil, water rinse, triclosan, which is the main component of your toothpaste, amine fluoride, stannous fluoride as well, hydrogen peroxide and oxidizing lozenges, and volatile compounds such as the metal salt solution, toothpaste, chewing gums. Mouth sprays, mouthwash rinses, lozenges and chewing gums can mask the malodor whenever you are in a public place or you are in a social, valuable cultural regions. And herbal treatment can be given such as raw carrots to prevent the bacterial plaque accumulation, and few herbal treatments can also lead to the proper digestion system of the stomach, which reduces the oral malodor. Cardamom tea contains cinnoli, a potent antiseptic that kills bad breath. Thymol, one of the constituents of the thyme, is contained in antiseptic mouthwashes. Neem leaves powder can be used as an effective tooth powder to fight plaque, and gingivitis is when mixed with astringents, herbs, powder, or the baking soda. A few drops of tea tree oil, lemon, or peppermint essential oils can be added in the warm water for an effective mouthwash rinse to freshen up the breath. So, coming to the conclusion, halitosis is a common complaint and can be periodically affect most of the population. Oral malodor is commonly noticed in the patient with the clinical signs and symptoms, which includes local and systemic factors. So, consultation and treatment may result in the dramatic reduction of the bad breath. Patient may find it difficult to sense the improvement, but with the professional therapy and the proper guideline given to the patient, we can reduce the risk of oral halitosis. So here we can together eliminate the bad breath. Thank you. So I request everyone to go through the halitosis, and till then stay safe. Thank you.